First and foremost, we're very focused on, there's a culture. I think all of Hearst Health is comprised of businesses that were pioneers and disruptors in their market. And, whether you go all the way back to First Data Bank, which is the first electronic drug database, everything was on paper. And there's a disruptive ethos or culture that's built into that. Then you kind of go to Zinc, which is the first company to do order sets and nursing care plans in the EMR, and everyone else was kind of reading them on paper, and it's disruptive. And I think MCG did the same thing with clinical guidelines. They were disrupting the status quo. And I think home care, home base with software in the EMR is disrupting how care is being delivered. And so you have this kind of series of disruptive cultures. And as long as you preserve that and keep that excitement around innovating new products, and you support them, you aggressively fund innovation of new products, I think you're not going to get it right every time, but over time, you're going to make the right choices that keep you ahead of the curve. Versus some companies, they'll say, we're just going to keep doing what we're doing, and we're not going to invest in new products, or we don't have nobody comes up with new ideas, and they end up kind of falling back and maybe becoming less relevant over time. And so it's aggressively focused on investing in new products and pushing leadership teams to think about and take the risk, and allowing them to not succeed in certain examples. And we've had a few where it didn't work, and that's okay, because the ones that do work, make us much more leading edge and pay, I guess, have a real benefit over the long run. So that's active. We're always talking about what are our new products, what's new that's out there being used by customers. We look at certain metrics about what's the adoption of products that didn't exist 5 years ago. That's a very important metric for us. And so, if we have a discussion and all the products that are being used today were invented more than 5 years ago, that's like a red flag for us. So that's one of the ways we think about it.